Mr. President, this week, perhaps as early as tomorrow, Majority Leader McConnell, who just left the floor, will ask the United States Senate to vote on a bill that we have not seen. That's right. We will be voting this week on a bill that we haven't seen. I think it's a first. I'm going to do a little research to see if this has ever happened before in the United States Senate, where members of the Senate were brought together to vote on a bill that has not been made public or printed for us to review. This isn't an inconsequential bill. This is a bill about the health care system in the United States of America. There's not a single American living in our nation today who will not be affected by our vote this week, because we are in the process of deciding whether we will change health care in America, health insurance in America. And there's not a single one of us who doesn't have a health insurance plan, either private or public, or not affected by the health insurance industry in healthcare across the United States. In fact, healthcare itself represents 1/6 of the American economy. So we're being asked to vote on a bill this week that has not been printed and given to us, which will change healthcare for every single American and affect 1/6 of the American economy. We do know that some of the previous provisions that have been brought before us on the Republican side have an impact, a negative impact. In my state of Illinois, a very personal negative impact. We know that their effort to repeal Obamacare, which has been a political slogan that's been used for 6 or 7 years, ran into a wall when the American people said, well, if you repeal it, what's left? What will be there? What will replace it? At that point, the Republican effort dissembled. They didn't have an alternative. They spent the last 6 years with Obamacare, the Affordable Care Act, saying, no, repeal it, without spending the time to think about what would follow, what's next. The Congressional Budget Office, this is an interesting thing. The Congressional Budget Office is a nonpartisan agency that we turn to that evaluates our work. They take a look at the bills that we write, they take a look at the laws that will pass, and they say, well, this is the impact it will have on the deficit, on future generations, on entitlement programs. Sometimes the Congressional Budget Office is maddening. They take forever. I don't know what's going on over there, but what you think is a simple question can take weeks and sometimes longer to result in an analysis. And there are times when I just flat out disagree with their analysis. Let me give you an example. When we debated the Affordable Care Act, we said one of the things we need to do is make sure there's plenty of preventive medicine. For example, we make sure under the Affordable Care Act that every senior gets a free annual physical. Our belief is if you detect a problem that a person has early enough, you might be able to lessen its impact or actually cure it. So we said that to the Congressional Budget Office, and they replied to us, you cannot put a dollar value on preventive medicine. Well, it's common sense, isn't it? If you find something early, it's more likely to be cured. It's cheaper. Nope. Can't put a dollar on it. So the Congressional Budget Office sometimes can frustrate us, but we rely on them. And I would say for the most part, they do give us good advice. I don't agree, as I said, completely with them, but they give us good advice. Do you know what they say about the Republican repeal plans that have been passed in the House of Representatives and have been suggested, the various versions that have been suggested? They believe that those repeal efforts will take health insurance away from 22 million to 32 million Americans. Think about that. We passed the Affordable Care Act because so many people in America had no health insurance, and we wanted to make sure they had it for their own peace of mind, for their own good health, to make sure there was fairness in our system so that sick people without health insurance who are cared for don't have their bills passed on to everybody else. Well, the Congressional Budget Office takes a look at the Republican plan that passed the U.S. House of Representatives by 4 votes, all Republican votes, 4 votes, and they looked at the plans proposed by Senator McConnell and the Republicans, and they said at the end of the day, 22 to 32 million Americans will lose their health insurance. They said in my state of Illinois, 1 million people out of 12.5 million will lose their health insurance. I cannot understand how any senator of either political party could in good conscience come here and say, boy, we had a great week. We just passed a health care reform bill, and 1 million people in Illinois will lose their health insurance. Really? That's why you ran for the United States Senate? To take health insurance coverage away from people? I would have thought common decency, common sense would suggest that we want to do just the opposite. We want more and more people to fall under the protection of health insurance. We also know that some of the reforms that we built into the Affordable Care Act are going to be changed by at least the early versions of the Republican repeal bill. Like what? Well, 1 out of 3 Americans has a pre-existing medical condition. A few weeks ago, I went through a heart procedure that worked out just fine, thank you. But now I have a pre-existing condition. Well, I'm in a pretty big company, 1 out of 3 people across the United States. Remember the day before we passed the Affordable Care Act? Before we passed the Affordable Care Act, if you had a pre-existing condition, if you could get health insurance, it was darned expensive. And sometimes, a good friend of mine, he had a little company, trucking company, he had some problems with his ankle. He went to the doctor. The next year, when they wrote the health insurance plan for his trucking company, they excluded anything on the health insurance policy affecting his legs and his feet. Each year, he said, I was afraid to turn in any claim because the next year they wouldn't cover it. It's a pre-existing condition. We changed that. We changed the law. We said in America, when you sell health insurance, you cannot discriminate because of pre-existing conditions. You can't discriminate with higher premiums because you have a child with diabetes. You can't discriminate with higher premiums if your wife has survived breast cancer. Now that to me is common sense, and it's humane. The Republican approach allows the states to waive that. Back to the bad old days when pre-existing conditions can run your premiums through the roof, where you have haves and have-nots when it comes to health insurance. And the Republicans said the other protections we put in the Affordable Care Act were also on the chopping block. For example, my wife and I raised 3 kids, put them through college. They had their health insurance when they were students. They came out of college looking for jobs, thank you. And it took a little while to find the right job. And we worried, now that they're not in school, whose health insurance is going to protect them while they're looking for a job with benefits? We put in the Affordable Care Act that your kids, young adults, can stay under your family health insurance plan until they reach the age of 26. It's just common sense. Keep them under the family plan until they have a chance to get that job with the benefits. We put other provisions in there, lifetime limits. It used to be you'd buy health insurance in this country, and to keep the cost down, they would say, got you covered. Up to $150,000, you're covered. $150,000 sounds like a huge amount of money to people of modest means and working families, but we all know you are one accident or one diagnosis away from having medical bills that go through the roof. $150,000, get real. That could be 2 days in a hospital with a doctor and a surgery or radiation. That's the reality. So we took the lifetime limits off the policies. They can't do that to you in America anymore. When you buy health insurance, you've got health insurance. And if, God forbid, your condition takes your bills to sky heaven, they're going to be covered. Now the Republicans say, well, that's another thing we'll take out. We'll make that optional. Can I tell you one other one that really gets me? Because it was a big debate here for years. Back where my friend Senator Sheldon Whitehouse is standing, used to be the desk of Paul Wellstone, a liberal senator from the state of Minnesota. What a good guy, terrific guy. And short, feisty, boy, when he got into a fight, you wanted to be on his side. Paul Wellstone teamed up with a man who sat right there, named Pete Domenici. Pete Domenici, exactly the opposite politically, from New Mexico, conservative, Republican, disagreed with Wellstone on virtually everything except for one thing. Each of them had in their family someone suffering from mental illness. And they decided that they were going to do something about the fact that most health insurance plans did not cover mental illness. It was a battle that went on for years to require health insurance to include mental illness. And they won the battle. And we put it in the Affordable Care Act. And now the Republicans say, well, let's make that optional. This is something you can buy if you want to buy it. At the end of the day, I think we all know that we need a health insurance plan that's there when we need it, that covers things we can't even imagine when we buy the health insurance, and it makes sure that people don't end up broke and bankrupt because of health care bills. That was the driving cause, the driving reason for people filing bankruptcy in America. Medical bills. They couldn't pay them. Since we passed the Affordable Care Act, the number of bankruptcies filed because of medical bills has been cut in half. So good health insurance that covers you when you need it and covers a member of your family when you need it is essential. And that's why this debate and this vote tomorrow are so essential. One thing I forgot to mention to you. Wellstone and Domenici didn't just cover mental illness. They put another provision in there and most of us paid no attention to it. Substance abuse treatment. That has to be covered in health insurance too. Is that important? Have you heard of the opioid epidemic? The heroin epidemic? I asked recently one of the best providers in Chicago about this, and they said, luckily, people who have a child who ends up being addicted and needs treatment, if they have private health insurance, there is some coverage. Now, there's a battle about how many bills will be paid and how much will be paid, but it's covered under the health insurance plan. The Republicans want to make that optional. They call it freedom of choice. The junior senator from Texas, Ted Cruz, talks about policies that you could buy that are really cheap policies. We call it junk insurance. You are insured in name only. If you need it, it isn't going to be there. That has been in the Republican plans that have come before us. We don't know whether that will be in the plan that we have to vote on tomorrow. We don't know. It is a mystery. How many hearings have been held on the bill that we will vote for tomorrow on proceeding to change health care in America? None. Not one. How many amendments have been offered? Of course, none. We haven't seen it. We don't know. We also know something else. The Republican plan on health care will slash the Medicaid program. Most people, myself included, a few years ago, would have been stumped to describe the Medicaid program and what it covered. Now I'll tell you what it covers. And think about cutting that, what I'm about to describe, by 25 to 35%. Number one, half of the children born in the state of Illinois are paid for by Medicaid. Their mother's prenatal care, the birth of the child, and postnatal care of mom and the kid covered by Medicaid, one half. In addition to that, every school district in my state, probably in Rhode Island, probably in Oklahoma, receives Medicaid payments. School districts. Why? For the kids with special education needs. Medicaid helps pay for counselors so that these kids can be mainstreamed in education. Medicaid in my state even pays for feeding tubes for those severely disabled children who are in school. 25 to 35% cut in the Republicans' proposals for Medicaid. But the most expensive thing on Medicaid, the thing that costs the most money I haven't mentioned. Is your mother in a nursing home? Is your father? Your grandfather? 60% of the people in nursing homes rely on Medicaid to stay in that nursing home and get the basic care they need. So when you cut that by 25 to 35%, what happens to mom? What happens to your grandfather? Does that mean the family now has a bill to pick up? Does that mean they have to leave the nursing home and go somewhere else? Where will that be? And that's one of the proposals. The disabled community, they stepped up and said as well, Medicaid is health insurance for disabled people in America. A woman in Champaign came to me. She said, I have a 23-year-old son with autism. He's pretty good. He's kind of on his own. He's doing some things. Senator, if he didn't have Medicaid health insurance, I'd have to put him in an institution. I don't want to do that. How important is Medicaid? How important is it that the Republicans will slash this Medicaid? It gets to the heart of health care for tens of millions of people in the United States of America. Why did the Republicans want to cut Medicaid? It's simple. It's linear. It's direct. They have to cut $700 billion out of Medicaid to provide a tax cut for the wealthiest people in America. Oh, Durbin, you're making that up. This must be something, a press release from the Democratic National Committee. No, that's exactly what it was all about. In order to pay for the tax cuts to the highest income individuals, to pharmaceutical companies, and to health insurance companies, they cut Medicaid payments to the states. They think that's simple justice. It's a tax cut. They're always for tax cuts. But look who pays for that tax cut. So who lines up for and against the Republican approach that we're going to get to vote on tomorrow? That's easy. There's not a single medical advocacy group in America today supporting the Republican position. That's a pretty broad statement. Better be ready to back it up, Senator. I'm ready. Hospitals, doctors, nurses, pediatricians, every medical advocacy group, community clinics, all oppose what the Republicans are setting out to do. And they're not alone. Remember the pre-existing conditions? I mentioned diabetes and cancer, the American Diabetes Association, the American Cancer Association, the American Heart, Lung, you name it. All of those groups oppose what the Republicans are setting out to do. They realize it is a dramatic step backwards in terms of health care in America. Every health care repeal bill that the congressional Republicans have devised to date has represented a massive step backwards for health care. None of the bills proposed by Senate or House Republicans would increase the number of Americans with health insurance coverage. It does just the opposite. None of them reduce costs or improve care. And you say, well, if you told me you don't know what the bill's going to be, and how are you describing it? I'm giving you the composite of all the bills that have been offered by the Republicans in the House and Senate. So far, we think one in the House for sure, 4 different bills in the Senate, what I've just described to you. You'll find in all the bills. They don't get better, they get worse. None of them would strengthen our health care system or improve people's lives. One of my Republican colleagues really put it in a few words very directly and said recently, I didn't come to Washington to hurt people. I trust that none of us, not a single Republican or Democrat, came for that purpose. We want to help people, don't we? Isn't that why we're here? And that's why we need to reject this approach. It's why we need to sit down together and make our health care system better. I voted for the Affordable Care Act. I believe in it. It cut the number of uninsured people in my state in half. And I think that's a worthy goal. And it made many other changes that I've described here this evening. But is it perfect? By no means. The only perfect bill, and I've used this example before, the only perfect law that I know of was carried down the side of a mountain on clay tablets by Senator Moses. Everybody else does their best, and sometimes we need a little help. Our current healthcare system needs some help. Let me tell you where I think we ought to change it. Number one, we know the one market where the premiums are going through the roof is the individual marketplace, where small business people and others are facing skyrocketing premiums. What percentage of America fits into that group? 6%, and they're not being treated fairly under the current system. We've got to change it. We've got to make health care premiums affordable. Every Republican plan brought before us raises those premium costs. Secondly, we don't address the cost of prescription drugs in the Affordable Care Act. And the health insurance companies tell us that is driving premium costs more than any single thing. Blue Cross Blue Shield in Illinois pays more for pharmaceuticals, prescription drugs, each year than they pay for inpatient hospital care. And there's nothing that's controlling these costs. We should, shouldn't we? And shouldn't we agree that if you happen to live in some part of the country where you don't have health insurance available in the marketplace, at a very minimum, you will have a public option. What do I mean by that? A plan that looks like Medicare, a plan that isn't driven by profit, but a plan that provides the basic services. We can do that. We have Medicare Advantage programs. We have other options. We want to make sure that's available to every American. You choose it if you wish. Those three things, right off the top, that I would include as part of what we can do on a bipartisan basis, Democrats and Republicans. Take the tax cut off the table, take slashing Medicaid off the table, take rewards to health insurance companies off the table, focus on helping the families and businesses and individuals in America who need this basic protection. So we're going to go into this mystery vote tomorrow. We've been elected to the United States Senate. There aren't many people in history that have had this honor. What we're doing tomorrow does not bring honor to the Senate. Considering a bill that has not been written, published, and disclosed to the American people is just wrong. Considering a bill that's never had a committee hearing is unfair. Considering a bill that I'm sure will have many flaws and weaknesses is reckless. And that's what we face this week. How important is it? It may be the most important vote we cast this year as far as I'm concerned. There's just nothing more important in life than the peace of mind of knowing that you have health insurance at that critical moment when you or somebody in your family desperately needs help. It's not going to be a minor amendment offered on the floor that's going to straighten out this situation. I'll close, and I know my colleagues are here to speak. I'll close by saying, if you come to watch this bill, whatever it is, brought before the Senate in the next few days, it will not be a moment when you think better of this place. It is a process called vote-a-rama. Vote-a-rama, here's what it means. You put an amendment on the floor, file it with the clerk, they read the amendment, and then you have 2 minutes. 1 minute for, 1 minute against, and you vote. Really. We're going to take the healthcare system of America and put it through that kind of a process where we don't even have time to sit and measure the impact of one amendment over the other. The Congressional Budget Office won't have its analysis, so it's really just going to be a free skate. We'll be up here trying our best to vote yes or no on these amendments if we proceed to the bill. But here's the good news. If 3 Republicans, 3 out of 52 will step up and say, stop, we can do better as a Senate, that will be the end of this terrible endeavor. We'll send the measure back to committee. We'll have Democrats and Republicans sit down. They'll go through the regular process. They'll produce a bill. The public will get to read it. They'll go through expert testimony. Then they'll have an amendment process. Then they'll bring it to the floor and we'll do the same. We will consider it carefully. We'll use our best judgment and try to come up with something on a bipartisan basis that is a credit to America. But instead, what we're going to face, if the majority leader has his way tomorrow, is a process which does not serve this country well and does not bring honor to the Senate. I urge my Republican colleagues, 3 of them at least, step up. You aren't just saving a lot of people across America from the worry of whether they have good health insurance when they desperately need it. You're saving the reputation of the United States Senate. Mr. President, I yield the floor.